Good morning, YouTube family and friends. Excuse me there. Uh, I hope you had a good week. Uh, my week was, oh my God. Oh my God. Included a trip to the ER for myself. Let me, I'll get into that here in a second. So let me start off by saying this is Saturday, June 22nd, 2024, and this will be my week 13 results being back on Mounjaro. But it's really going to be focusing on my health. Yeah, some things happened this week. So as you kind of see a little bit, I'm still having it happen. My eyelid is drooping, and my face was. It's not as bad as it was. So Wednesday I had Juneteenth off from my main job, and yeah, I had been feeling super tired for several days, and I had noticed it was on Monday or Tuesday this last week that my eyelid was droopy. And I didn't think nothing of it. I thought, it's nothing. I'm just seeing things. Well, then my nephew came over on Wednesday afternoon and had mentioned, it's like, what's going on with your eyelid? So, yeah, that got me concerned. So I snapped a picture of my face that afternoon. And you could see where, like, my eyelid was droopy. My whole right side looked a little droopy along with my lip a little bit. So let me input the picture that I took here. So as you can see by that picture, yeah, it looked pretty droopy. So of course I was panicking and thinking, God, did I have a stroke or like a mini stroke, like a TIA or something? No, where you don't really notice it. So, but I was thinking, I still didn't think nothing of it. Next day I went into work on Thursday. I went into work and they they convinced me to call the doctor's office, and so I was kind of really didn't want to because I knew what they're going to do. They're going to have me come into the doctor right away and so they can check it out. But I hesitantly go ahead and call my doctor's office, and of course, what they do, they said go to the ER right away. I was like, I don't think it's a stroke because no, I did all the tests. I could smile, I could hold out my arms, and it wasn't one of the arms wasn't dropping, so I wasn't slurring my words. So I really didn't think it was stroke related. Though I was really tired. My eyes have been hurting. I've been getting headaches lately. So of course I've had balance issues lately as well. That balance issue has been going on for quite a while, so that's nothing new there. But I was like, okay, yeah, I can go. I'll go ahead and go to the ER. But they said, well, we don't recommend that you drive. You have someone to take you, or do you need us to call you an ambulance, pretty much? I was like, no, 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 no. Like, I was like, I'll figure out a way to get there. It's like, okay, well, as long as you understand what we're suggesting to you that you do. It's like, I understand. So I got off the phone with the doctor's office, and I didn't have any. I was like, I've been doing fine. So I went ahead and just drove myself to the ER. It was no big deal. I knew it wasn't stroke related. I was pretty positive it wasn't stroke related. So I get to the I get to the ER on Thursday, and thankfully they get me right. There was no waiting line. The ER was pretty slow, thankfully, so I got in right away. And they ran. Of course, they had my blood pressure on me, and they took me up to an ECG. Even though I just had one done on Monday, because that Monday I had gone to the cardiologist and had an ECG done there. And the only thing that showed based on their results and what they told me was that I have bradycardia, which I already knew. The ECG on Monday had my pulse ranked at 44. So, but the cardiologist went ahead and scheduled for next month because they're kind of backed up. I'm having an echo done. I'm having a stress test done, and I'm having the Holter monitor, the 48-hour test where they hook you up to a thing that you wear for 48 hours just to see what the heart's doing. So that's in July. That's July 16th. I get to have that done. So, so I've already probably have it on the books to take a look at my heart. But the ECG results that I posted to my chart online for CHI Health, all it said was bradycardia. It didn't have anything else to it. Well, the ER did the ECG as well, and yeah, the machine that they hooked up, because it had that little finger thing that they keep an eye on your pulse and your oxygen level, and they hooked you up to other monitors, and the machine kept beeping on me because my bradycardia, my low pulse. It was kind of funny. They eventually had to turn the sound off on me, so I didn't have to listen to it while I was sitting in the ER room. So, but it was coming back, and it came back. They final note they put on there was 40. My pulse was averaging 40, so it was kind of low, and my blood pressure was good, but the bottom number was a little low. I'm gonna post what they noted on here right now. Okay, so as you can see, my pulse was 40. My blood pressure was little. I don't know if you call that low or not for the bottom number. And then the results of all the tests. So they say they think it's nerve related. I had some tingling sensation when they poked me on my right side, but they said that could possibly just be from my CPAP machine, my CPAP mask, because I have to wear it so tight. I could be pinching nerves on my head, which could be the result. That's why it tingles a little bit when I touch it or when they poked it, to see how I feel, how the sensation is. And so they did an ECG, they did blood work, they did a urine analysis, and they also did a MRI with and without contrast of my head. So, but sorry if I jump around here. I'm trying to make sure I remember to tell you everything. So the everything came back, and there was no definitive conclusion of what's causing it. They do believe it's nerve related, as you saw in that document. It said nerve related, or whatever that it said. They think it was nerves, something to do with nerves. So, but my blood work came back. It was okay, but there was something in the blood work, not in the blood work, but in the urine. I'm sorry, I'm jumping around here. Let me get back to the ECG. My ECG results posted last night on my chart. They didn't tell me this part of the ECG, and this is the first time I've read it. No, this note wasn't in my ECG from the cardiologist on Monday, but it reads sinus bradycardia, moderate voltage criteria for LVH, may be normal variant when compared with ECG of June 17th, which was Monday. It says no significant change was found. But that moderate voltage criteria for LVH, which is left ventricle hyper something, which means LVH means that there's something going on with here. I'm sorry, I don't remember the full definition. So let me pull it up here. I got my computer up so I can look some of this stuff up. But it's okay. It's LVH is left ventricle hypertrophy. Let me get to the description of it. Left ventricle hypertrophy is thickening of the walls of the lower left heart chamber. The lower left heart chamber is called the left ventricle. It's the main pumping chamber. So if that's happened, if that is truly happening, that can lead to a weakening of the wall. It's cardiac. It's a cardiac condition. So great. But it said it's when compared to the one I just had on Monday, it said there's no significant change found. So I wondered if that was present in that one, and the the cardiologist's office just didn't note it. So there's something else for me to worry about there. Like I need more stuff to worry about. Uh, so so that was the ECG results. So I have moderate voltage criteria for LVH. Don't know if it's anything or not. Uh, okay, so let's get to, they did a blood work for high sensitivity troponin, and that was fine. Normal value is less than or equal to 77 ng/L. Mine was at less than 4. So there's nothing on that blood work to show anything with that. They did a urine analysis. For the most part, everything looks good. But I did notice the urobilinogen UA is at the very bottom of normal. Here's a picture of it. All right. So a low one of those, a low urobilinogen is a sign of course, liver disease. If it gets to be too low or I don't know if it goes negative or not, but it can mean that you're into liver failure. So I think that's something. It's been this low before. According to the history on my chart, it's been at 0.2 4 out of the last 5 times they checked it. It was at 0.2 in 2016, 0.2 in 2020. It gone up to 1 mg on November 9th of 2023, but then right back down on November 27th of 2023 when they did a urine example again. It was back down to 0.2, and then it's still at 0.2. So I guess that's a good thing. It hasn't dropped below 0.2. But I think it's running low because of my liver cirrhosis. So hopefully it doesn't get any lower than that. And then so yeah, the MRI results. I don't have that posted to my chart, but I do have the printout from the ER room. So I'm just going to read out the instructions section from the ER about the MRI. It says, of course, you presented today for evaluation of paralysis of your face. I believe the tingling sensation to be due to your mask from your CPAP machine. You had some double vision as well, and therefore we proceeded with an MRI. I did have 2 episodes of double vision in the ER, as well as a dizzy, lightheaded spell. They had me sit up from the ER bed so I can go give a urine sample, and I had been had my eyes closed and almost falling asleep when they came back in the room, and I had double vision, but then so I had to sit there for a minute and get my eyes back in sync. It's so weird. It's like your eye one goes off filter, so now you look through both eyes. It's like in sync, but for some reason my left eye gets out of sync. So like I was looking at the doorknob of the door handle of the room, and it's like I was seeing double vision because one was like way the door handle was up here, and then it was also down here in my other eye. So I had to kind of blink several times, move my eyeballs around, trying to get them back into sync. So that's happened actually a few times. Happened again yesterday morning when I woke up. It seems to happen a lot when I have my eyes closed, or if I'm sleeping I wake up and it's double vision. But it has happened before while driving. So this last week. So, but anyway, when I got up after I got my eyes back into focus again, I went to go stand up so I can go give urine example, and I was lightheaded, a little off kiltered. So that's when they did decide to go ahead and do an MRI, even though I wasn't presenting any signs of a stroke. They agreed with me. No, I'm not presenting any other signs of a stroke other than the droopy eyelid, droopy right side. So, okay, here's what the rest of it says. It says, your physical exam today was reassuring, and your MRI showed incidental small perivascular spaces, which did not indicate any demyelinating disease specifically. However, do not rule it out. They are non-specific at this time and not evidence of stroke or MS currently. MS, what the heck? Okay, so I don't know if any of you out there know about incidental small perivascular spaces in head. What they described it to me as those little tiny pockets of fluid in my head. Uh, they couldn't. They didn't say they couldn't. They couldn't verify that that was causing my droopiness. They couldn't verify if it was caused a little stroking. Those signs didn't detail it. But they also couldn't rule it out, and they also couldn't rule out that those little things are the starting of MS. What the hell? Uh, there's. I don't think MS is hereditary, but I do have a family member that has it. I believe my boss at my main job has it. So, so I went online and Googled. I know you're not supposed to do this, but of course I do. Incidental small perivascular spaces. Depending on where they're at and how big they get, that could also be a sign, beginning signs of Alzheimer's disease. It's like, really? Like I said, I have balance issues. Sometimes I feel like I lose train of thought sometimes. Uh, yeah, I can, I get shaky sometimes, but sometimes I think, I don't know what, I don't know. I don't know. It's just, it's beginning to be overwhelming, folks. It really is beginning to be overwhelming. To know that now I might have to deal, I might have to think about possibly having MS, possibly having Alzheimer's. I don't, I don't know. So, it did finish reading what it has on here. Your labs were reassuring. I do recommend that you follow up with your cardiologist regarding your bradycardia and proceed with their plan as well, because they knew I already had those tests scheduled for next month. So, and they said follow up with your PCP, primary care provider, to discuss possible neurology consultation if symptoms persist. Well, Friday morning, he said I woke up in the morning and I had double vision again. I didn't have it this morning, but I'm having bouts of blurriness, and it's not both eyes. It's kind of going back and forth. It's just little bouts of blurriness. So there's something going on. So I went ahead and called my primary physician's doctor's office, and I made an appointment to follow up with her on Tuesday morning. So this coming Tuesday morning. So, and I also have my yearly eye exam Tuesday morning as well. So that's good. That's good timing. So I can talk to my eye doctor about the double vision, about the droopy eyelid. I don't know if they'll know anything about the droopy eyelid, but I can talk to them about my double vision and see what they say. But it really does sound like it's neurological. So I'm gonna talk to my primary doctor about the MRI results, about those little pockets that they found in my head. Uh, then also, I have blood work done Friday. I already had a schedule, a nurse appointment scheduled on yesterday, the 21st, to do more blood work to follow up in a month about, because I told my doctor I was concerned about the trend of my levels. There's two levels, two things I was concerned about. TSH, third generation, which is dealing with your thyroid. It had been on a steady incline, as well as my CO2, my carbon dioxide, which stuff when you breathe in oxygen stuff, and that creates carbon dioxide, so you have to breathe it out, and those levels have been increasing. Well, I thought we were going to check both yesterday, but test results came back last night on my chart. Only the results came back was TSH third generation. So it's like, did we check both, or was it maybe the carbon dioxide results just haven't come back yet? So if they don't come back by Tuesday, they don't post by Tuesday morning, I'm going to ask my primary doctor, like, hey, I thought we were checking both of these. but my TSH, third generation, did come back, elevated some more. It's back in 2020, I was at the top level of normal. It was actually a little bit slightly above normal, above 4.0, whatever it was, 3 point. No, it was my level at that in June 22nd, 2020 was 3.97 UIU/ml, which they noted as high because at that time it was above normal status. Well, then in 2022, they adjusted what's normal, and now normal is ranged up to 4.78. Well, and May 17, 2022 was at 2.13, so it had gone down from the high point. But then in June 8th of 2023, it had gotten up to 2.864. And then on May 20th of 2024 of this year, it had shot all the way up to 4.314. So that's two tests in a row it gone up and gone up significantly. Even though it's still in the new normal. The old normal, it would have been noted as high, but in the new normal, it's still within range. So, but I was concerned about it. So that's why I asked for another result. And she said, okay, we'll check it again in a month. Well, checked again yesterday. In just 1 month's time, it went from 4.314 up to 4.472. So it's still within the normal range, but again, it's projecting up, and for just 1 month, it like jumped up. So that's concerning that I do have possible thyroid issues. But we'll see what the doctor says. And I said, hopefully the blood draw, they were also checking the CO2. If not, I'm going to ask them to check the CO2 because that's another thing I was concerned about. Because that was at 32, which normal, the high point of normal is 32, so it was right at the top of normal. So, and with all how tired the last few months, how tired and drained I've been feeling, but it's been even more so this last week. Oh my God, I've been so tired. Haven't driven Uber at night since last Saturday night. I did drive during the day on Sunday for a few hours, and I drove since I had Wednesday off my main job, and College World Series is in town. I did drive for about 5 hours, but that was in the afternoon. It's 9 a.m. to 2 p.m., so it wasn't at night. So I haven't driven at all during the night. Even last night, Friday night, which is a money-making night, I didn't drive because I'm so tired. So hopefully I can drive tonight. We'll see how I feel. I am tired. I slept 8 hours, but my sleeping is not good. I keep waking up. Last night was a little bit better than what it has been. I only woke up a couple of times, but I keep waking up constantly throughout the night. So even though I haven't driven Uber, so I've gone to bed at a good hour, I'm not getting a restful night's sleep. I'm just so tired, so drained. I don't. I know I said the sleep study showed that I'm in severe sleep apnea now, but it's never been like this before. It hasn't been like usually it happens periodically, but it's like every night I wake up constantly, and that's what the CPAP is supposed to prevent. I'm on the high oxygen. I'm on the high pressure for the CPAP machine, but so I'm not getting restful night's sleep at all. Even taking time off of driving Uber, it's not helping. So, but yeah, I know this is a long video, folks, and bear with me. I just want to make sure I give you a full picture of what I've been dealing with, especially this past week. I hope I haven't missed anything. But I said that I'm really concerned about those little, what the MRI showed, those little pockets. Those again, it's called incidental small perivascular spaces. You can look them up. I don't know. Yeah, I know it's backwards. I'm sorry, folks, but if you can read it backwards, you can Google it yourself online and see. You can look it up if you're interested, if you're curious to learn more about it. Like I said, that could be concerning. It could be MS. It could be Alzheimer's. I did last night since I was home. I Googled, WebMD. I know my doctor yells at me like, "Stay off the internet," but it's really hard too. But I really think for my eye droopiness, and I think it's nerve related. I think I found what it might be. Let me pull it up here. It's called MG. It's called myasthenia gravis. It's spelled Myasthenia gravis. Second word is gravis. Gravis, and it's known as MG. Uh, it's a long-term neuromuscular junction disease that leads to varying degrees of skeletal muscle weakness. So, and why I think it might be that is the most commonly affected muscles are those of the eyes, face, and swallowing. It can result in double vision, droopy eyelids, and difficulties in talking, and walking. It fits. The early signs of it is droopy eyelids, one or both, or double vision, which is both what I'm having. You can also have balance issues, which I've been having balance issues. It's not always diagnosed right away because symptoms can come and go. So, but yeah, it's a little scary to think that it could get. If that is the case, it could get worse. It can affect like eating. It can affect breathing. It's the voluntary muscles. There's a I'm just bringing up web or Mayo Clinic. This is under the Mayo Clinic. It says your healthcare provider will look at your symptoms and medical history and conduct a physical exam. Your provider might use several tests, including a neurological examination. Your provider may check your neurological health by testing reflexes, muscle strength, muscle tone, senses of touch and sight, coordination, balance. Okay, that's issues I've been having. She knows I've been having those issues for a while now. They might do an ice pack test. If you have a droopy eyelid, your provider might put a bag filled with ice on your eyelid. After 2 minutes, your provider removes the bag and analyzes your droopy eyelid for improvement. I might try that on my own today. Blood analysis. A blood test might show non-typical antibodies that interrupt the receptor sites where nerve signals your muscles to move. Repetitive nerve stimulation is another way. So there's different things that they would check, and this is your neurologist would do this stuff. So that's another reason why I went ahead and scheduled follow up with my primary doctor on Tuesday. I'm going to talk about the MRI results, about everything, all the results from the ER, and see if she'll send a referral to a neurologist so I can go visit a neurologist and talk more about this stuff. Is it? Sometimes I think I'm paranoid, but yeah, compared to this eyelid, it is still a little droopy, but at least my mouth isn't droopy. I guess it is a little bit. When compared this side to that side, it does look a little droopy, so I don't know. All right, folks, that's enough of my medical stuff this week. This video is going to be super long. It's going to be over 20 minutes. It is going to be over 20 minutes. I'm sorry. Okay, now, week 13 results. If you stuck along this long, I'm glad you did. But unfortunately, I don't have good results for my weight this weigh in this morning. All I did this week was lay around. I didn't have any movements. I didn't even get out to drive. I just been either at work at my desk or at home in my bed. So stepped on the scale this morning. I'm at 225. Last week was 224. Last week was a 3-pound weight gain. This week is a 1-pound weight gain. So I'm now at 225 according to my scale here. Yeah, doctor's office has me at higher because I have clothes on here. I weigh myself in the morning with just my undies on, my skivvies. So I did gain 1 pound this week. So that 3-pound gain last week wasn't flux from vacation. I did gain. So I guess it is what it is. That takes it down my total weight loss from being back on Mounjaro for 13 weeks at 11 pounds lost. So But I got so much other medical stuff going on right now. I'm not too terribly concerned about weight right now. I really am not. As long as it doesn't go too haywire. I'm not going to focus on that right now. I need to focus on this, all my other medical stuff. Uh, I don't think I talked about it last week. My last week's video, I did get my temp crown in. I got a far tooth. That's a temporary crown because I got a crown right next to it. Unfortunately, that tooth that they put a temporary crown on, they think it needs a root canal. They did an X-ray for insurance after they built it up, and it shows that I could have a very bottom of the root. It's a sign that I need root canal. So next month when I go back in, when the permanent crown is ready to go on, before they put the permanent crown on, they're going to run a test on that tooth after they take the temporary crown off, and they're going to see if I need a root canal first, because they don't want to put the permanent crown on and then have to drill through it to do a root canal. So I have that to look forward to. The tooth's been aching, but it's the tooth right next to it that already has a permanent crown on it. That tooth has been achy. Unless it's the other tooth and it's just feeling like it's coming from that other tooth that has a permanent crown on it already. It's going to be weird. I'll have two permanent crowns next to each other. So, but yeah, that's something else for me to have to deal with. But yeah, thankfully my tooth ain't aching too much this morning, but it was aching a lot last night. I think that could be contributing to my headache. It's an achy tooth. So, okay, folks, that's it. This video's super long. I'm sorry, but I hope you enjoyed it. I hope you got something out of it. If you like it, hit the like button. If you want to know more of my weekly updates, hit subscribe so you can be notified when I post new videos. I usually try to do just one a week. So you don't get bombarded with videos from me, but they are longer videos usually. Especially if you're curious on how this plays out as we go forward with more testing and whatnot, and see what's going on with me. I'm just falling apart, folks. So if you feel free, please share it, so more people maybe that's dealing with the same issues that I am will know about it. I'm really sorry to get concerned. Is my health taking a turn for the worse? I have liver cirrhosis, I have an enlarged spleen, I have varices in the esophagus, I have my prostate is a little enlarged, I have mild thickening of the bladder wall. I just got all kinds of stuff going on. So yeah, it's really starting to play with my head big time. But it's just, I'm trying not to think this way. It's like, okay, it's as good as it's going to get. It's downhill from there. I don't think this other stuff is liver related, but it's like, if it's not, then I got liver cirrhosis on top of this other stuff I have to deal with. It's just, it's overwhelming. It can be depressing, especially if this stuff gets worse. I'm not going to be able to drive Uber anymore. If that takes that away from me, what am I going to do for my bills? I have to drive Uber. I have to have that second income coming in. If I don't have the second income coming in, if my health gets to a point where I can't drive Uber no more, but yeah, I can still work my main job, which is great because I'm on their insurance. They have great insurance, so hopefully I can work that job as long as I can. But if I can't do that second income, what am I going to do? I don't want to file bankruptcy. I might have to file bankruptcy at some point, but I don't want to have to file bankruptcy until I can include my student loans. The only time I can file bankruptcy on my student loans is if I go permanently disabled. So I don't want to have to file bankruptcy, but yet keep the student loans. And going down to the future, if I do get permanently disabled with all this crap, with the liver cirrhosis and whatnot, then I have to file bankruptcy again to get rid of the student loans. I don't know. I don't want to have to go that route. So I'm just, in my cruises, I'm getting cheap cruises. I say I got 4 more cruises planned this year. I've already taken 3, but that's taking a toll of my finances. I'm relying on the second income to help pay for all this. The cruises itself are cheap, but it's the flight. I live in Iowa, so I spend $600 to $800 on the flight to the ports. So I just booked my airfare for my Halloween cruise that I'm going on. But then I got a cruise 2 weeks after that. I haven't booked my airfare on yet, so that's going to be another $600 to $800. So even though I'm paying really cheap for these cruises. It's the travel to and from, not to mention the spinning on the cruise itself. I gotta get internet or whatnot. Do I stop? Do I cancel all my cruises? Especially if I can't drive Uber anymore. I don't think I'm to that point yet. But my cruises is what the only enjoyment I get out of life right now is taking my cruises. So I can't cruise no more. If I can't get that second income coming in, which means I have to file bankruptcy, which means I won't be able to cruise no more because I won't have credit cards no more. I guess I still could. No, because to book stuff, you have to have credit cards. I don't know. Okay, that's it, folks. I'm sorry. I'm going to end it there. I hope you have a good weekend. Enjoy life as best as you can. Don't forget to tell your loved ones you love them. You don't know when your time's going to be up. You don't know when you're going to start having issues like I'm having issues, and just flips your world upside down. So, but okay, I'm going to end it there. It's going to be a great day. Game 1 of the College World Series here in our area, Omaha. No, I live in Council Bluffs, Iowa, right next to Omaha, Nebraska, home of the College World Series. Game 1 of the championship starts tonight. Tennessee versus A&M. It should be a really good series. I'm hoping it goes 3 games. I really do, because I think they're both really good teams. So don't know who I'm cheering for, but I just hope for good. I hope for good games. Hopefully it goes all 3 games. Better for our local economy. So okay, that's enough. I'll talk to y'all later.